If you begin to experience any pain in your lower back or pelvis, please tell your midwife or GP. They will then ask you questions to exclude any causes of pain that are not related to the bones, joint, muscle or connective tissues in your pelvic area. If you are experiencing any of the following symptoms alongside your pain, please go to be reviewed at your local maternity day assessment unit or maternity triage. The contact number is on your pregnancy notes. Occasionally, pelvic pain needs urgent medical attention. If you have any of the following bladder or bowel changes, please go straight to be reviewed at your A&E. It's getting more difficult to pee, less sensation when trying to pee, less sensation when wiping yourself with toilet paper, you cannot empty your bladder or bowel completely, it's getting more difficult to stop or control the flow of urine, you can't tell if your bladder is full or empty, loss of sensation when you poo, losing control of your bladder or bowel. When completing these exercises, please position your ball or chair next to a steady surface that you can use to stabilise yourself if you lose balance. Start by thinking about the muscles around your vagina and back passage. These are the muscles we are aiming to engage. The movement we are aiming for is a squeeze and a lift. Let's help you visualise what to do to help you complete the exercise as well. First, start by tightening the back passage like you are trying not to fart. Then think about zipping upwards from your back passage to your vagina to achieve the lift. All other muscles around your bottom and hips should be relaxed. 10 short holds at the speeds demonstrated in the video, 10 long holds 3 times a day. Sit on a Swiss ball or chair. Activate your lower abdominal muscles by bringing your belly button inward, like you are drawing your bump in. Make sure you are not holding your breath. Breathe as you normally would with your back in a neutral position. You can place your hands under your bump for feedback to check that your tummy muscles are activating. Hold this position for 3 to 5 seconds, then relax and repeat. Try and repeat this exercise 10 to 15 times. Sit on a Swiss ball or chair. Roll your pelvis backwards to sit further onto your coccyx tailbone. Rounding through your back, then roll your pelvis all the way forward, sticking your bottom out. Keep your stomach relaxed. Repeat for 30 seconds throughout the day as needed. Sit on a ball or chair with your thighs parallel to the ground, your feet flat on the floor and your back in a neutral position. Breathe in to prepare. When you breathe out, lift one heel like so. As you breathe in, lower your heel. Breathe out and now lift the other heel of your other foot. If this is too easy, you can lift your leg like so. Make sure you breathe out whilst lifting. Try to keep your exercise ball as steady as possible. Hold on to a steady surface if you feel unbalanced. Continue for 30 seconds, 2 to 4 times. Sit on a ball or chair with your thighs parallel to the ground, your feet flat on the floor and your back in a neutral position. Activate your lower tummy muscles by bringing your belly button inward, like you are drawing your bump in. Breathe in to prepare. When breathing out, slide one foot forward along the floor like so. As you breathe in, bring your foot back. Breathe out again and repeat the exercise with your other leg. If this is too easy, try straightening your leg out in front of you, lifting your foot off the floor. Breathe out, lifting the other leg like so. Try to keep your ball as steady as possible. Hold on to a steady surface if you feel unbalanced. Continue for 30 seconds 2 to 4 times. Sit on a ball or chair with your thighs parallel to the ground, your feet flat on the floor and your back in a neutral position. Start with your hands on one side of your body. Breathe in to prepare. Breathe out whilst pulling the band diagonally across your body. Inhale to return. Ensure you are completing on both sides. Continue for 30 seconds 2 to 4 times. Sit on a chair and put a band around your thighs just above your knees. With your feet slightly apart, stand up, keeping your knees hip width apart and slightly pushing against the band. Return to your starting position in a slow, controlled motion, sticking your bottom out. Do not let your knees fall inwards. To make it easier, you can add pillows to the chair to increase the height. 30 seconds, 2 to 4 sets. Place the ball between your back and the wall, standing with your feet slightly in front like so. Slowly bend your knees, keeping your knees hip width apart. Slowly return to the standing position and repeat. When bending your knees, only bend them as far as is comfortable for you. 30 seconds, 2 to 4 sets. Lie on your side with your knees bent and your back in a neutral position. Your feet should be in line with your back and bottom. Keeping your feet together, open your knees like in the video. Do not roll back. Pretend a wall is behind you, stopping you from doing this. Everyone's range is different, so only open your knees as far as you can in a comfortable, pain-free range. 30 seconds, 2 to 3 times on each leg. Lie on your side with your knees bent. Keep the bottom arm on the floor. Rotate your trunk following your top arm reaching back, opening up the chest. Follow with your head. Maintain the position for 5 to 10 seconds and return slowly to the starting position. 30 seconds throughout the day. Sit on a ball or chair with your thighs parallel to the ground, your feet flat on the floor and your back in a neutral position. Turn your shoulders to one side, keeping your back and pelvis completely stiff. Slowly return to the middle and repeat on the other side. "30 seconds throughout the day. Start on all fours with your hands underneath the shoulders. Round your back, bringing your bump up. Then lift your head and arch your back, lowering your bump. Hold each position for a deep breath and repeat as you feel comfortable. If you have any wrist pain, place a rolled towel underneath your palm or bring your hands out slightly in front of your shoulders. 30 seconds as needed throughout the day. Start in a tall kneeling position, facing a ball or sofa. Part your knees to allow room for your bump. Roll the ball away to stretch your back. If you do not have a ball, stretch your arms out onto the sofa in front of you and gently let your tummy lean forward. Repeat this movement for as long as you feel comfortable.